guys, welcome back to Medical Coding with Blue. Today's episode is all about the biggest mistakes that new to medical coding job seekers make. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so when you're out there seeking your first job in medical billing and coding or just medical coding, there's going to be a lot of obstacles because you will see that majority of employers are asking for experience. Blue, how am I supposed to get experience if no one will hire me? Well, here's the thing, guys. These things that I'm going to talk about today, hopefully you can avoid making these mistakes that a lot of people make because they just don't know. And there's no manual, guys. There's no manual for how to find your first job in medical coding. All you have is the word of other people who have been there. And then you have just the word of other people who can't find a job for whatever reason. So hopefully these tips today will help you. So here we go. All right. So the very first thing that you should be looking at is what you are looking for when you're looking up jobs, right? What types of jobs are you looking for? Not every place is going to list their medical coding positions as medical coder. Sometimes they have them listed differently as health information technician, sometimes as revenue cycle technician. So there's a myriad of names that come with just being a medical coder. So you really have to pay attention to the job listings. So I recommend just going through and seeing any of those other like hook names that you can kind of tell that it's sort of talking about medical billing and coding. So that's one of the things that I would start off with is what am I entering in when I'm looking at the jobs, right? So the best place that you can go to start looking for jobs in medical billing and coding or medical coding is to your association website. Oh, they will always have a job bank. AHIMA, the American Health Information Management Association, has a job bank for their members, and I'm fairly certain AAPC has a job bank as well. So be sure to take the time to go through the listings. Even if they're asking for experience, you still want to look at the listings and get familiar with the terminology that they are using to describe medical coders, okay? Because I'm pretty sure you can sort them by first listed. I've been able to do that when I look at the AHIMA job bank. So, you know, there's many ways to look at these things, but look at what you are entering in, because some people will say, well, Blue, there's just no jobs in my area. And then when I do the search, sure enough, I find a bunch of jobs. It's just because they're entering in the wrong name. So it's not always going to be under medical coder, okay? So you have to think of other names. And again, going through the job listings can really help with looking those things up. So that's the first thing out of the way, right? The next thing, which is the most important thing, and I say this a lot, but this is not my number one mistake that new medical coders make, right? That's going to come towards the end. But this is a huge one, guys. Your resume. Resume, resume, resume. I will say this till I'm blue in the face. Resumes, guys. When I see the state of the resumes that even I see on LinkedIn, and I see these from brand new people, and they're like, I can't get a job. Your resume is the number one reason you can't get a job. It's way too long. Some of them have 4 or 5 pages. And I know that people are trying to be like encouraging and they say, oh, this is great. No, if you know anything about resumes, you know that it is very important to keep those resumes short. You have to get to the point. The whole point about resumes is this is your calling card. This is what they're going to see of you in 2 seconds. Because all these people that are applying for jobs, they're going to be sending in their resumes as well. So you have to think about the person who's actually having to look at this resume. And if they see like 4 or 5 pages, I'm going to skip that resume, right? If I'm a hiring manager, I'm going to skip that resume. And I have done many videos on my channel specifically about how to write your resume, what to put on your resume, and what to avoid having on your resume. I also do resume rewrites myself. My rate for that is in the description box below. And for me, whenever I write a resume, I always meet with a person. We have a 30-minute Zoom meeting so that I can get familiar with what they want and what are their goals when it comes to finding your first job. And I get to know about their additional skills, because sometimes when I see resumes, all their skills are not even there. And so when I talk to the person, I'm able to get that out of them, and we get their resume all shined up and nice. So again, if you're interested in booking a session with me, my rate is in the description box below. But the thing about resumes, guys, is you have to take them seriously. And the space that is on your resume is prime real estate. You have to make every space count. You don't want to put too much, but you don't want to put like things that shouldn't even be there, right? If you're putting on your skills, and this is my #1 pet peeve when I see it, organized team player on your skills list, I would reject that simply because you're not understanding what skills actually means. Your skills are all the things that you learned in school, okay? That's what you need to put on there, because those are your hard skills. Your soft skills are organized team player and all that. And that should go on your cover letter. And yes, cover letters are supremely important. For those that are out there saying that, oh no, nobody reads cover letters. Nobody reads form letter cover letters. There's a difference. If you are generally being yourself and you're saying all about your soft skills and you know why you would be great for this position, that's something different from somebody who says, I am seeking a challenge and I want to get this job, and just like, I'm going to fall asleep looking at it. So that cover letter is going to be the icing on the cake. That's really going to get them to draw you in. Like, oh, okay, well, this person really seems genuinely interested in our facility here. So let's go ahead and give them a call. So that's what you need to make sure that your resume and your cover letter both look good. Because again, that's the only way that you are going to get the attention of these employers. And they take those resumes very seriously, guys. They do. They really do. And yes, you can farm it out to a professional, but you have to keep in mind there's a difference in the professionals too, because if the person that you're sending this off to has never been a medical coder, doesn't know what medical coders actually do, and there's just a professional that just sort of plugs in a templated resume together, again, you're basically wasting your money, because what is that going to prove? What does that show to the employers other than it looks clean, maybe it looks neat, but does it give the substance that the employers need when they're looking at a resume? And somebody who has medical coding experience is going to know exactly what that substance is. I'm just saying. So, resumes, that's very important. And that's a big mistake that a lot of new medical coders make, is not taking the resume seriously enough, okay? So I'm just leaving that advice there. You can check through my videos about the resume tips. I've given plenty. So again, you can write it on your own. You can try to farm it out. You can contact me. My rate, again, my contact information is in the description box below. So with that said, the most important thing that is the biggest mistake that new medical coders make is, well, actually one more. Only seeking remote positions. Only seeking remote positions. That's one of the big mistakes. Because before the pandemic, if you did not have 3 to 5 years of experience, you were not getting hired to work remotely if you had no experience, right? Before the pandemic. But since the pandemic, you know, they knew they had to kind of work with people, because everybody was on lockdown in 2020, you know, and no one could get in. So they still needed medical coders, because medical coders were still retiring, or, you know, some of them were getting, you know, let go, you know. So there was people that they needed to have new staff come in. And so because of that, you know, they were like, okay, well, we're going to go ahead and train people to work at home, and, you know, we'll do that. And there's some people that are still working at home even to this day, you know, because that was their first job and they're really comfortable. They love it. But I really do think that they're missing out on that developmental part as a brand new medical coder. When you are brand new, you need to be with people. And I will always say that. People think that this is, oh yeah, you can do it at home because whatever somebody at the school told them or whatever. And guys, it's not that way. We need time with other medical coders to help develop us. It doesn't have to be forever. It just has to be just enough in the beginning so that you're not so lost and confused. Because even though you may have made it out of that time where you're at home, being trained at home, it doesn't necessarily mean that there's not anything that you could still learn, right? If you were around medical coders, other medical coders, I'm just saying. So that's just something that you have to know, guys. If you can, okay, because I know, before anybody says anything, I know that there are some people that live in the rural area, so it's a little bit harder to get into town. I get that. I totally get that. So yes, in those instances, I understand, right? Or, you know, maybe you have like a family member that you have to take care of, and so you really kind of need to be at home because they need round-the-clock care and that kind of thing. That's something completely different. That's different. Even though it's going to be an uphill battle for you, I understand, okay? I want you guys to know that I do understand. But I'm saying that it's going to be an uphill battle if that's all you're looking for, all right? If you are flexible enough that you can go to a place where you have to be trained and then they turn you loose to go home, then that's a good thing, right? That's a really good thing. So that's just something that you have to think about when you're out there looking for jobs. You don't want to only seek remotely. And I'm really talking to those who really can go to a place, they just don't want to. There's a difference between want and need, okay, guys? And when you want things your way, and there's just, what you want to do and only what you want to do, and that's what you zero in on. Again, a lot of missed opportunities happen because you are just so fixated on what you think the ideal working environment for medical coding is. And now, yes, I understand the hesitancy to work around a lot of women because, trust me, I've been there. When I worked in a room with 20 women, that was really difficult. So, I understand it. I understand, trust me. But again, it is part of it. And a lot of times, if you can get training and then be turned loose home, you are set up way more for success. Okay. And then for those that think that, working at home is a dream and you've never worked at home, oh, trust me, you'll see quite the difference. Because to me, I've worked at home twice. And the first time it was a pleasurable experience because, we weren't on lockdown. The second time we were on lockdown and I literally couldn't take it because to me, it was not a good thing for me. The house is too quiet. I'm used to the hustle and bustle of the clinic, and that's how I'm able to concentrate. And so with that, again, would I ever work remotely? I mean, technically with all of you, yes, I do still do that. But no, if I could absolutely help it, me personally, no. I think that the better place for coders is in person with the doctors. That's just my own personal opinion. And I know there's going to be people who disagree, and that's fine. It's okay to disagree, folks. Doesn't mean that we're against each other. It just means that we disagree. And to me, if you're not spending time developing those relationships with your providers, it's harder for you to understand what's going on in that note because you don't really know how they think. There's a difference between what they write and how they act and what they say in person that'll kind of give you those clues like, hey, maybe there's something missing here, And doctors don't know because they are not meant to be medical coders. I'm just saying. So what is the number one mistake new medical coders are making? The number one mistake, right? Are you guys ready for it? The number one mistake that new medical coders are making is only seeking entry-level positions. That marvelous little phrase, entry-level medical coder. That's what they're looking for. If you are looking for that, you're going to be looking for a long time. And even if you do find it, guess what happens? There's about 1,000 other people that you're going to be competing with because they saw entry level. Guess what? They know that you don't have experience. They know that you don't have a background in medical coding just yet. They know your entry, your entry level. So my advice is this, guys. Apply for places even though they're asking for experience. If the role is in medical coding, okay, pay attention because you don't want to go for something like CDI because you're not qualified for that yet. If you're a brand new medical coder, you are not qualified for CDI yet. I'm just saying, okay? But I'm talking about those medical coding roles, inpatient coding, outpatient coding, professional fee coding. Those are the types of roles that you can apply for. Why? Because you have training. Now, the job listing may say this position requires 3 to 5 years of experience. You still apply anyway, because if happy coders are in the area, they're going to stay where they are. If they are not happy, obviously, then they're going to go looking around. So guess what happens? Meanwhile, you're in an area and there's a lot of happy coders, and maybe a few are out there looking and, you know, putting their fishing pole out there to see what's going to bite, you know, and then there's a bunch of new coders in the area, but nobody's applying for these 3 to 5 year position required things because they're too scared and they want something that says entry level. But meanwhile, you've been listening to Medical Coding with Blue, and Blue said to apply anyway. Why? Because it's, number one, it's free. Number two, you have to put your name out there, because if you don't, they don't know you from Adam or Eve. All they know is that we are looking for medical coders. We are desperate right now. We need medical coders, and nobody's applying. Oh, this person just applied. They don't have any experience. You know what? Forget it. We're just going to go ahead and give them a test and see what they got. Here you go. Here's your test. Now you have a test to work with. Let's see how good you can do. Okay, I've been studying because I listened to Blue when she's over here constantly saying, you guys need to work to the workbook. You guys need to work to the workbook. And I've been studying. So let me go ahead and start, you know, doing this test. And I'm going to turn it in. Oh, you know what? This person actually did pretty good on their test. Let's go ahead and give them an interview. You see, you move through two other paces versus the person who never applied for a place that is requiring experience, or wants experience, or experience is preferred. Preferred does not mean required, by the way. So now you're 2 spaces ahead. And even if you have that interview and they say, well, we're going to go with another candidate, it's okay. You know why? Because you got something else too. You got something out of them. You got how to build your interview skills so that when you go to the next one, you're going to be even more relaxed and more confident. And then when you go to the next one, again, even more relaxed and more confident. And not only that, you are going to learn what the industry is looking for based on what that employer was looking for, based on what the next employer was looking for, based on what the next employer was looking for, and you can add all of that together. And that's when you're going to start getting more confident. Okay, I know that at this place, they wanted somebody who coded this, or they coded this way here. And they may not give you your score. They may say you either passed or failed on your assessment test. Sometimes they will not tell you, like 98% of the time, they will not tell you what you missed, okay? Because these are like protected documents, because if they gave out the answer key to everybody, then, you know, their test would essentially be worthless because everybody could pass their test, you know? So that's why they don't really tell you what you got wrong, you know? But, you know, and sometimes when you take the test and they say, well, you didn't do so well on it, you can ask them politely, okay, do you think I can take this test again? Even if I don't get the interview again, I would just like to just take the test again and see how I do. And sometimes they will let you. I've had many people comment and say that, you know, they were nervous on the first run at it, and so they asked them if they could take it again, and they were gracious enough to say, okay, here you go. And the score went up, and for some of them, the score actually stayed the same. I heard from one, the score actually went down. So it just means that when you're doing this, it's going to give you an idea of, hey, did I do better? And that's sometimes they'll do that. That's their way of helping, you know, but again, it's going to take you to be vocal and for you to say, can you give me a chance? You know, that's all, guys. And you don't feel sorry for yourself. That's the number one, again, another number one mistake that new medical coders make when they're out there job seeking is they start to feel sorry for themselves. You're not unable to work during the time that you're looking for a job. I know, because I did it. I still continued to work at a halfway house, at a bar where people talk to you all kind of crazy ways. I still continue to clean houses, which people treat you very mean when you clean houses. People who clean or, you know, clean restaurants or clean houses or whatever, you know, people are not always the nicest too, you know, and so I dealt with that. you know, while I was still looking for a job. But it still gave me the motivation to say, okay, I'm gonna do this. I'm gonna keep going until I get somebody to say yes. And then I went to the temp agency because my mom said go back to the school, ask them for help. The school was like, okay, I have a friend with a temp agency, and they said, you know, well, you know, take this test and we'll see how you do. And you know, I passed the test, and they got me a job within a week. So it's different when you are applying for places like a temp agency, because temp agency doesn't require you to have experience. They just need basically a body to fill a seat, and you need experience. So you can look in your area for temporary agencies for medical professionals. Please don't ask me, guys, because it's Google. You can just Google that, and you'll be able to find in your area the people who do that. So, you know, that's just my advice anyway, guys. It is an uphill battle to find your first job, but it's not impossible, guys. It's not impossible. And especially when you stick with it, because right now is that time that you're going to start developing that thick skin. And if you are a real thin skin person, this is going to be even more harder for you. Okay, guys, it's not personal when they are turning you down. It's not. It's just something, it's business, guys. Think about it. It's business. So again, just keep going. It's not about how many times you get knocked down. It's about how many times you get right back up. And the more persistent you are with your quest to get a job and to get started in the field, the better off you'll be. But again, the number one thing is saying and looking for those entry-level positions. Don't do it, guys. Don't only seek entry level. Look for job positions for medical coders. Okay, even if they're asking for experience, you still apply anyway. That's just my advice anyway. I'm gonna wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share it. And I will see y'all next time. Bye.